doctor.
Hi, welcome back.
Thank you.
Can you verify your name and date of birth?
Yes, name is IVB.
Okay.
Last name ASMR.
Perfect.
Date of birth is June 2nd,
Okay.
1992.
All right, and tell me what's going on.
So, last week I fell down. It was very silly. I just tripped. There was a step, I didn't see it. I fell down. And I bumped my head. I felt kind of like on the side, very weird.
Okay.
And I bumped my head on the side. And since then, I've been feeling like I have this bump. And sometimes it's like throbbing. And sometimes it feels a little bit like numb.
Okay. That's definitely something that we need to look into. Sorry that you had that fall. Happens to the best of us. So you said it's throbbing. Does it hurt any particular time of day, or is it just kind of constant?
Yeah, it's kind of constant.
Okay. All right. Any itchiness?
No itchiness.
Okay. All right.
I do feel some kind of like a tingling sensation sometimes, or it feels like a little bit numb.
Definitely that goes with the numbness. Yeah. So I'm going to ask you some neurological questions, but first, have you noticed any bumps anywhere else in the body? Anything else from your fall?
Just the head.
Okay, all right. So, well, any other health concerns today? Just the bump?
Yeah.
Okay. When was your last checkup?
It's been a while. Maybe like 2 years.
Okay, wow. Okay, and so for the neurological questions, so you are having numbness and tingling, so we have answered that. So any new headaches that have been accompanied with this, talking about like increased migraines or?
No, I haven't noticed that.
Okay, it's all just coming from the source of the injury. Okay. All right, any supplements that you're taking or medications on a daily basis?
I take vitamins.
Okay, that's good.
I take a bunch of them, like
What?
omegas and
Okay.
B12.
Okay.
Some other hair vitamin for hair growth.
Collagen supplements are all the rage now. Any changes in vision?
No, I actually just had my eye exam done recently, and it did increase my prescription.
Okay, all right. So no sudden onset of blurriness?
No blurriness.
Okay. What about your smell and taste? Have you noticed anything different?
No, not really.
Okay, great. And do you notice that the pain gets worse when you have sun exposure?
I haven't really noticed that.
Okay.
There hasn't been a lot of sunny days
Yeah,
lately.
that's true,
So.
yeah. All right, so I'm going to go ahead and get your vitals, and I'm going to just do an examination of your ear, nose, and throat, just to rule out anything too serious, and then I'm going to give you a full in-depth scalp examination, just so I can see and make sure that there's nothing else to be worried about, okay? Okay, great. All right, I'm going to go ahead and take your temperature. All right, just hold that in your mouth for me. Thank you. Could you hold that? And I'll take your oxygenation as well. Okay, so you could give me your index finger. Thank you very much. So you're 97% islet room air, and your heart rate is 72. Your temperature is 97.8, so that is all within the normal range. So that's good. I'm going to do your blood pressure next.
Okay.
Okay. Can I go ahead and use this arm? Okay. Go ahead and slide this up. Okay. Okay. All right, just relax. Okay. All right, that's 110/80. So that's very good. All right. Let's slide this off. There you go. I'm going to listen to your heart and lungs. Okay. So just breathe normally for me. Good. Okay, again. All right, I can only hear S1 and S2 so far, no extraneous noises. I'm going to flip this over. Just keep breathing like you were. Good. Okay. All right, no murmurs present. I'm going to go ahead and listen to your lungs. Okay. Just, why don't you give a few deep breaths for me? Okay. In, 2, 3, and out. 2, 3. Good. In, 2, 3, and out. 2, 3. Good. All right. Now listen on the other side. Okay. In, 2, 3, and out. 2, 3. Good. And in, 2, 3, and out. 2, 3. All right. So that sounds excellent. Next, I'm going to listen to just underneath your ears. I'm going to be listening to that pulse. Okay. So if you go ahead and put your hair just behind your shoulders. Good. All right. Okay. Okay, good. Okay, that sounds very good. All right, I'm going to look at your eyes now. I'm just going to be peeling down this bottom lid. Okay, so just look up for me. Yes, very good. All right. Very healthy tear ducts. Your veins have a nice pink look to them, which is what we want. And look in this one. Sorry about the brightness. Okay. Very good. Okay, now I just want to test your focus. So if you could cover one eye. Good. And just follow the light for me, okay, with the other. Keep your head straight. Don't move it. Just move your eyes.
Okay.
Okay. Good. Switch to the other one. Okay, same thing. Excellent. Okay, you can put your hand down. So next I want you to tell me when my fingers enter your field of vision. I'm going to be coming a little close, so hopefully I don't have terrible breath. So just let me know when.
No.
Good. Good.
No.
Good. right. Now I'm just going to be taking a closer look with your eye. Okay, so look straight ahead for me. All right, let me see. Very good. Your optic nerve is intact. Your pupils are round and reactive. All right, I'm going to look at the other side here. If you could just look straight ahead. Yes, very good. Okay. All right, everything looks healthy. All right. If you could open your mouth for me, I'm just going to look at your salivary glands and just check. Okay. All right, excellent. I don't see any irritation. Your glands seem to be very intact. Your tonsils look very healthy. And also your teeth look very clean, so that's always a good bonus. Very good. Okay. All right. I'm going to be looking up your nose, okay?
Okay.
So if you could just look up for me. Perfect. Okay. Very good. I don't see any polyps. Everything seems to be intact. Excellent. Okay. The other one. Very good. I'm going to be giving you a smell test. All right. So if you could close your eyes and just inhale. Let me know what this is.
Oranges.
Okay. All right. And this smell.
Lavender.
Okay. So your smell seems to be a bit compromised because they are both banana. I'm going to go ahead and write that down. Just make a note of it. Right? Okay. I'll be looking inside your ears now. Okay, so. Okay, we have a very nice pearl gray tympanic membrane. Okay, and let's see. Same on this side, very little wax buildup, so that's good. Okay, close your eyes, and I want you to tell me which ear you hear the sound in. First of all, do you hear this?
Yes.
Alright, now tell me which ear you hear the sound.
Left. Right.
Good.
Left.
Good.
Left. Left.
Good.
Right. Right.
Good.
Both.
Good. Alright. So I'm going to be making two different sounds, and I want you to tell me which one sounds closest to you.
Okay.
Okay? So this is A. This is B.
A.
Good. This is A. This is B.
B.
Okay. This is A. This is B.
A.
Okay. And this is A. This is B.
A.
Yes, very good. Okay. So this is a tuning fork. Do you hear the sound?
Barely.
Barely?
Yeah.
Okay.
Yeah.
Okay. I want you to let me know when the sound stops. Okay? You can go ahead and close your eyes so you don't see me stopping it. Okay.
No.
Okay. I'm going to actually move it behind your ear so it's a bit easier to hear.
No.
Good.
No.
Good.
No.
Great. I'm going to move on to the other ear.
No.
Good.
No. No.
Good.
No.
All right. And I want you to tell me which is louder, A or B.
Okay.
This is A. I'm so sorry. This is B.
A.
That would be
Definitely.
A. Yeah, definitely. Okay. This is A. This is B.
No. Which was A?
Let's do it again. This is A.
Okay.
This is B.
B.
Good. All right. This is A. This is B.
A.
Excellent. I'll do the other ear. Okay. This is A. This is B.
B.
Good. This is A. This is B.
A.
Good. This is A. And this is B.
A.
Excellent. All right. So I'm going to give you a sharp and dull test now. So close your eyes and tell me which one you feel. This will feel like a dull sensation. This will be sharp. Okay?
Okay.
All right.
Dull.
Good.
Dull.
Yes.
Dull.
Yes.
Dull.
Yes.
Sharp.
Yes.
Sharp.
Okay.
Dull. Dull.
Good.
Sharp.
All right. And what side of your face did you feel that last one on?
Left.
Okay, good. What about this?
Right.
And what is it, sharp or dull?
Dull.
Good. What about this?
Dull. On the right.
Great. One more.
Sharp on the left.
Okay. So your preliminary exam, everything's showing up normal so far except for your smell. I'm going to have you lay down on the bed and I'm going to do a scalp examination next, okay?
Okay.
So let me ask, on a scale of 1 to 10, how much is it hurting right now, the bump?
I would say maybe a 4 or
Okay.
5.
Okay.
Yeah.
Great. Okay, Abby, I'm gonna move your hair. Okay, so if you could just move your hair here and move back for you. Just gonna be doing some light palpations just to feel for any excess contusions. So point to me where you think the bump is.
It's right here.
Okay. Oh yeah, I do feel that. Okay. Alright, I'm just going to be examining the rest of the surface area of the scalp, okay? Right. So your hair follicles are really healthy. Okay, just gonna be looking here. I don't see any signs of infection, but the bump is quite prominent. Okay, so I'll be definitely applying some topical ointment to that. That is going to also has temperature sensitivity to stimulate cellular movement and hopefully reduce swelling in a way that doesn't have us using high ibuprofen and all of those pain medications that can really affect your liver. So do you take Tylenol or ibuprofen on a regular basis?
No.
Okay, good. Yeah, the inflammation is there. It definitely is localized. You'll have some strawberry moles I'm seeing on your scalp. I don't know if you've ever noticed them before, but I like to do some measurements just to have them on record so we can track their growth and make sure that they are benign, which they definitely are, I can tell. But sometimes over time that can change. Okay. Just taking a closer look here, just to the area. This would definitely benefit from some topical treatment. I know you mentioned numbness and throbbing, but given the results of your cranial nerve exam, I don't see any concern with the concussion. I really do think it is just very inflamed. Okay. And the wound is superficial. So that's good. Have you applied anything to it yet?
No.
No, nothing. Okay. And you've been just showering as regularly, washing your hair. Okay.
Yeah. I try not to touch it
That's
because
good.
it hurts.
That's very good. Okay. Alright. this is a cortisone-based treatment. It's going to really help with the inflammation and also acting to cleanse the area. Okay. So I'm applying it along the ridges of the bump, just on the outside, just to start the process. Just to exercise caution, I'm going to take alcohol, a rubbing alcohol, and wipe the very center of the wound before I apply it there. Okay. Any pain there?
Not really.
Okay, that's good. Okay. Alright, let's see how that feels. It should feel a little bit tingly, and within 15 minutes you should start to feel a little better. While I have you here, like I said, I'm going to go ahead and measure those moles. Okay. And to do that, could you go ahead and turn around and face down on the bed? Okay. 4.4 millimeters here. Okay. Alright, this one's a little larger at 6.5. Okay. Okay, see one here. That is 4.1, so that's a tiny one. Okay. 6.9. Okay, 7 millimeters. Just put that down. Larger ones, I'd say your largest at the crown of the head is 8.3 millimeters. I think I just saw a couple more that I wanted to track here. Okay. Alright, 4.6. Alright, just gonna be taking one last look. Okay, and since you mentioned numbness and tingling, I'm just going to do an abbreviated version of that sharp and dull test, but since it is your scalp, I'm not going to put anything pointy there. So instead, this is going to feel like a dull sensation, and this will feel cold, and I want you to let me know what you feel, okay?
Okay.
Alright.
Cold.
Okay.
Cold.
Good.
Dull.
Yes.
Cold.
Okay.
Sharp.
Okay. Do you feel that at all?
Dull.
Okay.
Dull.
Okay.
Sharp.
Okay.
Cold.
Good.
Cold.
Good.
Cold.
Good.
Cold. Then feel that.
Okay.
Sharp.
Okay.
Dull. Dull. No.
Okay. All right. So, okay, Ivy, since the wound is superficial, I'm going to go ahead and send you home with some of that ointment, and I want you to apply it every 8 hours.
Okay.
Okay? Now, since your smell was compromised and also your numbness on your head is quite prominent, I'd like to schedule a follow-up for next week.
Okay.
And we're going to look at it again after the ointment and after we give it some more time to heal. If nothing has improved, I'm going to refer you to a neurologist just to make sure that there's nothing underlying happening.
Okay.
Okay? So you can go ahead up front and schedule that follow-up appointment. Do you have any questions?
No, thank you so much.
Okay, thank you so much.